Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Community acquired pneumonia, we are looking at the empirical antibiotic treatment. So in terms, the patient is a outpatient. So in terms of outpatient, the treatment regimen, it includes in terms of previously healthy. So in terms of previously being healthy, what is given? So here there is a use of macrolides as well as the doxycycline. Then in terms of comorbidities, how does it change? In terms of comorbidities, it is a respiratory fluoroquinolones, or what is administered? The beta-lactam is administered along with the macrolides and the doxycycline. So the macrolide and the doxycycline is administered. Now let's look at inpatients or the non-ICU. So in terms of inpatients and the non-ICU. So here there is again the respiratory fluoroquinolones. So respiratory fluoroquinolones, or what is given? There is a beta-lactam. So respiratory fluoroquinolones or the beta-lactams along with the macrolides, and also the doxycycline. So in patients there is a non-ICU, there is a respiratory fluoroquinolones or the beta-lactams along with the macrolides or the doxycycline. Then moving on to the inpatients and the ICU. So here how does it change? So here you give a beta-lactam, and along with this there is a respiratory fluoroquinolones. So there is respiratory fluoroquinolones or the azithromycin. Next, we look at conditions where there is presence of the Pseudomonas. So if the Pseudomonas is present. So in terms of the Pseudomonas is present, what does it have? So here there is an anti-pseudomonal B-lactam. So there's anti-pseudomonal beta-lactam, and along with this there is also the fluoroquinolone. The fluoroquinolone or the aminoglycoside. So fluoroquinolone or the aminoglycoside, along with this there is also the azithromycin. So these are the what are given. So Pseudomonas, anti-pseudomonal beta-lactam, fluoroquinolones or aminoglycoside, as well as the azithromycin. Next is if there is CA-MRSA. So in terms of CA-MRSA, what is given? Here it is the site-based regimen. So there is a site-based regimen is given. Along with this, there is also the linezolid or the vancomycin. So the linezolid as well as the vancomycin. And so this is in CA-MRSA. So there is site-based regimen, there is linezolid or vancomycin along with the clindamycin. Now let's look at the other. What we need to know is macrolides. We're looking at the groups. So macrolides, it includes the azithromycin as well as the clarithromycin. Next is fluoroquinolones. The fluoroquinolones, there is something known as the respiratory fluoroquinolones. So this includes the levoflox as well as the moxifloxacin. Next is there is the gemifloxacin. So gemiflox is used in terms of the only outpatient. This is outpatient. Now let's look at the beta-lactam. So under beta-lactam, the outpatient with the comorbidities. So in terms of outpatient with the comorbidities. So in terms of outpatient with comorbidities, there is PO plus amoxicillin. So in PO there is amoxicillin, and there is plus or minus the clavulanate. Then comes the cefopodoxim. There is cefopodoxim as well as the cefuroxim. The cefopodoxim and the cefuroxim. Next we look at the IV. Under IV there is ceftriaxone. Now let's look at the inpatient or the non-ICU. So here in terms of the inpatient, the inpatient or the non-ICU. Here IV, what we give is the ampicillin, ceftriaxone, the cefotaxime, as well as the ertapenem. Then we look at so this was the non-ICU IV. Then looking at the inpatient ICU with IV. So here again there is a use of ampicillin plus the ampicillin sulfactam. Then there is use of ceftriaxone and the cefotaxime. So ceftriaxone as well as a cefotaxime. Next we move on to the anti-pseudomonal beta-lactam. So anti-pseudomonal beta-lactam. So anti-pseudomonal beta-lactam is IV. So this includes, there is piperacillin as well as tazobactam, piperacillin, tazobactam. Then there is use of cefepime. There is imipenem as well as a meropenem. So under the aminoglycosides, what is included? It includes the amikacin and the tobramycin. So there is presence of amikacin as well as the tobramycin. To learn and grow daily like this, please do subscribe.